culturally rejected by most cultures. It is culturally fine that if there are sex worker areas and they use condoms, it's good for everybody. Yeah.
Okay, and then next, our site in Salemba, UI Salemba. Do you have question?
Yes, we have a question. Hello, Professor Hira. My name is Rina.
Yes.
In one of your slides, you showed us that there are different HIV subtypes, and we know that HIV is able to mutate. Now, my question is, what is the impact of this situation to ARV treatment in the future globally? And then the second question is, you showed us a model of reducing HIV transmission among sex workers in Kenya. Can you also give us information how effective other prevention models are, such as PMTCT or harm reduction? Thank you very much.
Okay. Yeah, I think we've got two questions. One question you asked about is the antiretroviral drugs and how this mutation, constant drift of the envelope proteins of the virus and occurrence of recombinant forms will affect the future of antiretrovirals. Now, the answer is the mutation itself is not a major threat. It's a major threat to developing an effective preventable vaccine or a therapeutic vaccine. But as far as antiretroviral drugs are concerned, the drugs are basically working on the stable components of the virus, which is the pole and the gag proteins, not the envelope proteins. So the antiretroviral drugs, they work on the stable genes of the gag and the pole, and not the envelope, which is all the time changing. So it will not have major effect in terms of the utility of antiretroviral drugs. What might happen is, irrespective of the mutation of the virus, the inadequate or inappropriate use of antiretroviral drugs could lead to resistance in the virus, development of resistant genes in certain loops of the virus, because the individual has not been consistent with the medication, has not been adherent to at least 95% of the pills per week, and so on and so forth. So in that case, I think I've clarified the two things, that let's not be worried about the mutation as far as ARV is concerned, because ARVs work on the stable portion that doesn't mutate. Only the envelope mutates. And the second is that the real risk is that if these antiretroviral drugs are not monitored well, and then I think we'll come in the next lecture somewhere we are going to talk about, if we are not monitoring them well because we think that we do not have CD4 enumerators, or we cannot simplify CD4 technology to monitor them or do the viral load, I as a public health person, don't believe that the science has become so lost that this huge potential of scientists cannot find how to simplify a CD4 testing or how to simplify a viral load testing in our villages. I don't believe this, because I did patent one of the CD4 technologies myself, which is on a simplified glass slide. So I think it's somewhere there where we have lost our determination to do things. Otherwise, I think we have enough scientists, we have enough people, we have good institutions to do it. And public health institutions that I see now on the screen, they are phenomenally good. I think I'm very pleased that I'm talking to you all.
Okay, thank you, Prof. Hira. And the last side is UI Depok. Do you have question, UI Depok?
Yes, I have one question. Okay. We do know that condom have a high efficiency reducing HIV transmission. But as we know, in Indonesia, we do more promote male condoms than female condoms. And in fact, that men have high resistance using condom. Any policy that we do more promote female condoms reducing this transmission? Thank you.
Yeah, I think you're right. There are both pros and cons with both of them. But now, since the female condom is available, it is available in Indonesia through the government systems of delivery for sex work areas, because that is the area where there is so much of vulnerability and risk is there. But obviously, I think some point in time, if there are other populations that really need to use them, even for the sake of contraception, I think it's something that is now available. We all have to make sure that people know that this does exist, so the end users know, and the groups of, maybe there are groups of women associations that would know. There are very literate women who want to protect themselves from unwanted pregnancies, so yeah, that's fine. And I think it's an effort that we should all make, using it in culturally sensitive environments and groups. So if there are married couples and want to use it as contraception, I think that probably is okay in most environments. So yes, I think we should promote it. We should make sure that information is available to all the people, and that's our job, public health. Yeah.
All right. So this is the end of the session 3. So let's give applause to Professor Hira.
Thank you. Thank you.
All right. Okay. Okay, we have run out of time, 15 minutes from the schedule, and let's move on to the next session. So we'll invite Pak Pandu and Pak Iwan Aryawan. Thank you.
Okay.
Excuse me. Hi, can you hear me?
Yes.
I'm from Malaysia. Sorry, I'm from Malaysia. I just want to know the time difference because I'm trying to organize the time. We seem to be on a different time zone. So what time is it in Jakarta now?
It's 10:30.
Yeah.
10:30. Okay.
Yeah.
The sessions actually start at 10 or 9 or
9 Jakarta time.
or 9 a.m. Jakarta time. Okay, now it's 10:30. Thank you very much.
What's the time there, ma'am?
The time there is 11:30.
Oh, so you're 1 hour ahead. Okay. Great, thanks. Well,
Okay, I'll wait for the next session. Wow, 9 to 10.
Okay, let's continue with our next session because we are already run out of time. So the next session will be HIV/AIDS epidemic situation in the Asian region and some country-specific issue in the region. And the speaker will be Dr. Pandu Riono. And Dr. Pandu is a faculty staff of the Faculty of Public Health, University of Indonesia. He is a medical doctor, graduated from University of Indonesia. Then he received his master from University of Pittsburgh, USA. And then he received the PhD in HIV/AIDS epidemiology from University of California in Los Angeles. Dr. Pandu is expert in the quantitative epidemiology related to infectious disease, and he worked a lot with the HIV and AIDS in Indonesia and in the Asia region. He is already working in AIDS since 1990, so Pak Pandu already have a long history in working with HIV and AIDS. Okay, let's continue with Dr. Pandu lecture. Dr. Pandu, please.
Okay, thank you very much. And I will talk about the HIV epidemic situations in Asia, in some countries, but not all countries, but mostly because of
I can't hear you all.
Okay. Can you hear now?
Yes,
Okay,
I can.
thank you.
Thank you.
Okay, thank you. And I would like to talk about the HIV/AIDS epidemic situation in Asia, in some country, but maybe some example is come from Indonesia. We knew that Dr. Subas is actually already mentioned that the HIV is not easy to transmit. But even that, we have a look at the epidemic is growing and grow up in every regions, and there's no country there's never report about HIV epidemic. In Asia, especially, it's different. That's why it's different. It's not the same with Africa, and also because of the transmissions in Asia is more complex than in Africa. What drives this epidemic in Asia actually is related with drug, injecting drug use, sex works, men sex with men, even marital sex also contribute also the epidemic, extramarital and premarital sex, and the mother-to-child transmissions. And most of this is we can see that the 2 month is contaminated. That 2 month is the main driver of epidemic is sharing contaminated needles among IDUs and unprotected multiple sex behavior. This is the main mode transmission is Asia. And we knew that this Asia, all the Asia, including India, Vietnam, Cambodia, and some country is very diverse. It's very diverse because even they have 2 behavior related to sex and drugs, but the magnitude is different. And we can see also the growth, the trend. Since 1990, we see the transmission is the more the dark of the color is grow up. It means that currently epidemic in Asia still growing up. It's not yet finished or not yet major. Even that we can see in some area still already declining. This is the example of the trends in Asia. People living in HIV/AIDS, the same with the picture that already presented by Professor Subas, that from 1990 until 2007, we see a lot of grow up the people living with HIV/AIDS. It means that if we want to prevent the epidemic, we should prevent the new infections. This is already infected and still continue that will be distribute or transmit. Two more difference, drugs and sex. We can see different behaviors also produce different trends, because among drug user is easily transmitted because blood to blood. We can see they will grow up faster, and then suddenly they will something like saturated or then declining, because many drugs people also infected with another, like hepatitis C and hepatitis B, and some of those also dying earlier. But different with that, sex transmissions will be very slow and then continue growing up to until some peak graphic that will be continue. We don't know until when. This is the number. This is the estimated number that already presented. This is example from Indonesia. If we want to prevent the epidemic on the transmission, we should go to the people who has some behavior that high risk. We cannot promote HIV/AIDS to all the people because this is not yet generalized epidemic. Like in Indonesia, the IDU, we have only 200,000, and half of them has partner, have wife. And sex workers is only 200, around 200,000. But the clients is 3 million. It means that we should also go to the male, to the man who has high-risk behavior, not only go to the female sex workers. Because half of the client also have wife. This is, we always forgot that the network of transmissions is to be important to prevent, like to prevent mother to baby. We should to prevent to the male first, and then male to not only male, and then their wife before they continue transmit to their baby. And the MSM is around 700. It means that this group will become more important in the next year or the next future in the Asia region, because the HIV prevalence is now grow up among men sex with men. Now we should understand that the epidemic in Asia is more complex. Not only female sex worker to the clients, but also some of female sex worker also have client that drug user. And maybe sex workers have multiple high-risk behavior, not sell sex, but also inject or using drugs. This is the important because in Vietnam, why in Vietnam prevalence among sex workers is very high, because many of female sex workers also inject drugs, and mean that they share needle, and mean that the female sex worker is more tend to be infected, and then the transmission to the clients. And MSM, men sex with men, also important. Some of them also not only sex with men, but also visit sex worker. And some of them also using drugs or sex with drug user. And many of MSM in Asia, including Indonesia, has wife or have sex with female. It means that even male sex with men become important because they become a bridge to their female clients. This is important because we knew that the dynamic of epidemic in Asia is not easy, not only sex with men, female and men, but also they are related each other. And in here, if we want to prevent the new infection among Sorry. If we want to prevent newborn infection, we should go to here. If you go in here, it's too late. It's too late. We should also working in here before they infect to the female partner and then to newborn baby. Okay, this is the trends of HIV prevalence among subpopulation in Indonesia. We can see that in drug user in the red line is now around 50% of drug user in Jakarta. In some area, Surabaya and Bandung, half of them is already infected with HIV. And transgender now become the second high prevalence, is around 22%. And female sex worker is become the third of the trends will be follow after transgender. It means that in Indonesia itself, most of the HIV prevalence is still growing up. Now is the Papua. Papua is the part of Indonesia, they said that Papua is different with the other part of the country because the prevalence among the group is very high compared to the other part of Indonesia. And the data, behavior surveillance survey in Papua in 2007 show that multiple sex partner is the main mode of HIV transmission in Papua. Even that is, we can still, not all Papua have the same hotspot for the behavior because there are some different. We can see the variability of the Papua. We can see in here, a man is higher, almost 2 times compared to the woman, I mean. It means that 3% among adult male, already infected in Papua. And woman is only 1.9%. It means that male is still become more important issue in the for high risk group in Papua. And many people say that because the sex industry maybe influence the epidemic, it means that epidemic should be in the city or in the lowlands. But actually, the epidemic or the higher prevalence among people is not tend to be like that. We can see in the lowland difficulty, we have a higher prevalence and compared to higher lands, in the highlands. But in the city or the lowland EC area is only 1.8, in highland 2.9, like in the mountain area, and is in the very difficult area that we cannot reach by boat or by car is 3.2%. And that's true that behavior among people is influenced, even influenced by ethnicity. It means that we can see in Papua is higher, 2 times that people non-Papua ethnicity, even they living in Papua. It means that some behavior difference also influence based on the ethnicity that also reflect in the HIV prevalence in Papua itself. This is why we should understand. People tend to say that Papua epidemic is like Africa epidemic. Actually, it's not. It's a difference. Asia epidemic is not the same with Africa epidemic, even in Papua. Why? Because of the transmissions is still behavior in the multiple sex partners is still dominated by men. Women's only 7% who has multiple sex partner. It means that we never or will be very difficult to reach the epidemic in generalized, because all the transmission will stop to the woman. If the women have multiple sex partner, it means that transmission is still going on. They will stop to themselves or transmit to their child. It means that why in Asia is not will be different with the Africa, because the behavior of women is not the same with the behavior of men. We should say thank you to the behavior of women. That's why, because the HIV will stop in themselves, in the women, or to the baby, because their behavior is very small to have multiple sex partner. Now in the future, we should look at another epidemic that we can already look at in Asia. Especially, we can see men sex with men, like in Cambodia already 14%, in Beijing 0.6%, in Shanghai 1.7%, and in Thailand is 10%, in Jakarta it around 8% in here. It means that epidemic in the future will go to the MSM if we don't have a good program and still denial about men sex with men behavior. Maybe the growing epidemic will be become more important in Asia. Still, we should have still promote condom, because in men sex with men, not only working with they have sex with men, but also working with sex with the female. And the condom still important for this kind of behavior beside lubricant. The more important is also because here the percentage of condom use still very low. Here is the blue one. If they sex with male sex worker, only 39% in India, people MSM, men sex women, using condom. If not using in the department, not male sex workers, increasing become 50%. With female sex worker, they tend to be higher. This is the difference. Partner, they have different behavior of using condom. Actually, in here, with their male sex worker should have higher the same with female sex worker. Like in Indonesia, we have also the difference condom use among MSM based on their partner. It means that some issue or some misperceptions among MSM when they use condom. Actually, for every partner, they should using high condom. This is the picture, the HIV epidemic in Asia. Even in Asia, two main modes, drugs and sex, but we can see every country has different patterns of epidemic. Even within country, the epidemic also very differs. It means that the epidemic should understand the local epidemic in Asia. Even in Asia, should be Java and Bali or Sumatra is different epidemic. It means that there's no one solution for all. And epidemic, especially now, is epidemic in Indonesia and Vietnam is still grow and become more diverse because the behavior is very complex. And even that, we can see the HIV prevalence in some countries in Asia like Thailand, Cambodia, and in Myanmar is so declining because of the condom use or some prevention efforts among sex industry, that's especially sex in the brothel area. It means that in the broader area, we can promote 100% condom with different type of strategy that they can contribute declining of HIV prevalence that contribute by sex industry. It means that we can see from Huras-Bas condom promotion is more important because drugs and sex sex is more complex. There's only condom can prevent the transmissions among this high-risk group. High-risk group using condom, or they change their behavior. If you want to see more information, more graphic, more data, more behavior, just go to the aidsdatahub.org. That's the website that developed by UNICEF and some ADB working with ADB. There's a lot of data you can download. For Indonesia, we have a lot of data. This in www.ina.org that can you see the all study, all report that you can learn about the HIV epidemic in your area. Thank you very much.
Thank you, Dr. Pandu. Now we came to the session of question and answer. And for the efficiency of time, I will call the site, but I will collect the question from 3 sides before then Dr. Pandu will answer. Okay, for the first round, I will call UGM, Gajah Mada. If you have any question, please.
No, we don't have any question. Move on to other.
Okay, thank you. I move to Hasanuddin, Makassar. If you have any question, please.
Yes, yes, I already.
Ini sekianunya.
Ini.
Itu ya. Cara pakai. Tidak, ini pegang.
Okay, thank you. My name is Linda from Hasanuddin. Hello. Thank you. Good afternoon, Mr. Professor Pandu. My name is Linda for Hasanuddin University. This time I want to sharing a little story from around me. There's so many teenagers was die. The example from my friend in my office and my teenage they have lost their son, and they was die because HIV, and most of them get HIV from drug by sharing needle. It's so sad. And my question that how to approaching to their parents, because we know generally the parents who have low education about the knowledge about how to get HIV. Now how to make approaching for them from the parents, because they have so low education about knowledge. You get it, my question, Mr. Professor?
Yes, thank you.
Yes, we get it. Next side is Udayana, Bali, please.
No question.
Udayana, Bali, do you have any question?
Yes, thank you. I have heard about the circumcision, and what do you think about it? It is has circumcision can prevent the HIV transmission among male to female or female to the male who has circumcision. Thank you.
Thank you.
Okay, thank you. We already have 2 questions from 3 sides. Please, Pak Pandu, to answer and discuss about the question.
Okay, thank you from Linda from Makassar. That's true that drug user in Indonesia is different with drug user in some country because they are young and they're still living with the family. if most of them, I mean half or more drug user already infected by HIV, it means that not only HIV, maybe hepatitis C, because hepatitis C is easily transmitted compared to HIV. It means in their body have two infections, and most of them also got TB, because TB among young people tend to be higher among drug user, especially in Indonesia. It means that it is very difficult to have this situation like this. The more important is to educate drug user not sharing needle, or they should stop using drugs inject by send them or persuade them go to the methadone clinic. It means they have some substitution therapy. It means that they can reduce infections because of this kind of behavior. And then, because most of them easily go to the AIDS, it means that they should go to the HIV test and to the doctor to get access to antiretroviral as soon as possible, because most of them already CD4 maybe already less than 200. That already it means that because most of the drugs, I mean the drug user now is, we can see some of them already died because late to be diagnosis or late to be got ARV treatments. And then the third is, if they have partner, if they have wife, drug user have wife or has sexual partner, their sexual partner should be tested. Should be tested. It means that we can prevent the transmissions to the mother if this wife become pregnant. It means that from this kind of point, the interventions among drug users should be comprehensive, not only one solutions, because they tend to be already infected and diagnosed. This is should be. It means that can be supported by peer group, also can be supported by their parents, if their parents, but please don't send to the jail, because this kind of behavior is then, if they go to the jail or to the prisons, and this kind of drug user will be death sentenced, because in the jail is the limitations of the health facility. It means that now the interventions among drug users should be more humans than treat them as the criminal. And the second, asking about circumcisions. That's true that many studies already prove that circumcised among male reduce 1/3 on the average, or some already 1/2 the transmissions. It means that for the people who has high-risk behavior, it means that are living in the high-risk country, that the male is better also promoted to be circumcised. Even the prevention is not 100%. If we can prevent this male to be infected, it means that we can prevent also the transmissions to their sexual partner or their wife. It means that many people said, oh, if we promote circumcised among male, we just prevent male to be infected. But actually not. We also prevent their sexual partner to get infected, because we prevent this male to be infected. Thank you.
Thank you. Now we go to the second session. First, I will ask from Monash, Malaysia. Do you have any question, please?
Yes, I have a question. I noticed in your, I think the last few slides, you mentioned, you stated that countries like Vietnam and Cambodia had declining rates of HIV infection. So what were the programs that they instituted in place to make that happen? Which of the programs were the effective ones that resulted in the declining trend of HIV infection in those countries? Thank you.
Okay, thank you. Now I will give the opportunity of University Diponegoro, Semarang. If you have any question, please. University of Diponegoro, Semarang. Okay.
Hello, yes.
Yeah, please. Yeah, please.
Can you hear me, please?
Yes, we
okay.
can hear you, please.
Okay, thank you very much for the time. My name is Suratman. You said that topography is one of the factors that influence the spread of HIV, especially in Papua. Could you please explain this matter, and how about in another place in Indonesia? Thank you very much for the time.
Okay, thank you, Undip. Now I give the opportunity for the UI Depok, please.
Yeah. Thank you very much. Yeah. Thank you very much. Can you hear me? Hello?
Yes, we could hear you.
Yeah,
yes,
okay.
Please give the question.
Okay. I have one question. We have a good discuss to make dissolve about the HIV. It means now a good situation for us to discuss using condom. But we know that in Indonesia, I know that we use A, B, and C. It means condom is that's A is abstinence, and B is hateful, and C is condom. But now we discuss about the condom. Maybe condom is a good alternative for us. But I will ask you about the. We know that HIV are the social sick, maybe, I don't know. But the community say that HIV is social. So many stigma, and then they are discrimination. But the person are HIV is a human. So we must reduce the stigma and the discrimination. How about the good program to reduce the stigma and discrimination? Thank you.
Okay, thank you. We got your question, and then we already have 3 questions. Dr. Pandu, please.
Okay. First is come from Malaysia. That 3 countries actually that we can see if they do the preventions properly and they understand the local epidemic in their own country, they can prevent and have some good results. Like Thailand, like Cambodia, like Myanmar, they have a good program in the brothel area because they promote condom in the sex worker industry. It means that not only working with the government, but also working with the sex worker, with the team, and working with all stakeholders in the sex industry. That I know that in that area is illegal. In many countries, sex industry is illegal. Because illegal, they can make something that if you want to continue, have some place to sell sex, but they should promote using condom. It means that you should prevent the infection. If they have some infections occur in that area, government can closing down sex industry, especially in the brothel area. In the other area, maybe some, like Indonesia, in some province, they can work with the brothel. Like in East Java, near Suko, health center with the brothel owner working together to promote condom, and they can successfully to reduce STI infections. I mean the sexual transmitted infections, mostly is gonorrhea and chlamydia. Hopefully they can see also declining of HIV in the near future. It means that condom promotions is important. This is related with the second questions. It means condom promotion is still important, especially for those who have high risk. Where is high risk? In the sex industry. Where is sex industry? You know. Its easy part is in the brothel area. If you closing the brothel, sex industry is still there. It means that it's very difficult for public health to promote condom or monitoring using condom, because we cannot see where sex industry is. It means that ABC is yes. We still promote ABC to all people, but for high-risk group, we should promote condom, because they cannot be abstinent. Sex worker cannot be abstinent. They should sell sex. Cannot be faithful, because they should service their client. They have multiple clients every day. It means that the only promotion is condom for sex industry. And what is the third?
The other question is about how to reduce the stigma.
Okay. Stigma. Condom is stigmatized too, because many people said if you promote condom, you promote the sex, free sex. There's no free sex actually. More sex with many partners. But actually not. Actually, we promote condom to people who already getting high-risk sexual behavior. It means they should prevent themselves and their partner to get infected or transmit infections to their sexual partner. It means that we knew that condom is still stigmatized. For the people, many people, discrimination is stigmatized because many people like men sex with men, sex worker. Most of this kind of behavior is not approved by norm people. That's why many people said, oh, this is not our behavior, this is their behavior. It means that they have some social disease. Actually, if you want to prevent the infection, we should dealing with kind of issue, not throw away them or marginalize them, but we should work together. They should have some capability to promote, to know how they prevent themselves and get access for the treatment. Mostly stigma and discrimination because they're afraid also infected, like in the doctor or dentist. They don't want to treat HIV people because they're afraid to get infected. Actually, it's not. HIV is not easy to transmit. If the health worker, doctor, dentist use the standard, universal standard for preventing the infections, they can treat, and they can treat HIV is like another infectious diseases. One question from about the why in Papua in the topography in influence. This is a big issue and big mystery questions. Why in highland, in the mountains, or in the area that very difficult to go there because there's no transportation, or the transportation is not easy, but HIV prevalence is getting higher. Many explanations. One explanation is people in that area it's not easy to get access for health services, including informations. And the second is, most of these people also mobile to go to the area. And maybe some behavior also influence this kind of behavior. If they go to if people go from the mountains or from the difficult part, go to the city, that's why there's many people can easily get sex, buying sex. It means that kind of behavior also influence. This is following that questions. Currently they have anthropological study to see is there any behavior that influence among people in the lowlands, easily access, highland, or lowland is difficult to access. Maybe in the end of this year or next year, we can find out why topographical also influence this. Is there any kind of this situation from different part of the country? Yes, like in the city, in Java, is the sex industry in the north highway is different with in the south highway. I mean the south is not just no highway. In the north highway, there's so many sex industry from Jakarta until Surabaya. They have many sex industry in the highway for the trucker, for the some trucker that also influence this kind. It means that area, hotspot, or some places determine their own epidemic because the local situations will influence the local epidemic or the transmission is there. It means that everybody should understand the local area and the local epidemic and the local behavior. They can predict what kind of behavior that we can also intervene. Thank you.
Thank you. Now I give the opportunity for Unhas, Universitas Hasanuddin, Makassar. Do you have any question? Universitas Hasanuddin, Makassar, do you have any question?
Hello?
Hello, yeah.
Okay. Hello? Can you hear me?
Yes, please.
Yes, silakan.
Okay. Like this year presentation about HIV transmission in Papua with prevalence is very high, cause multiple sex partner and commercial sex behavior. My opinion, root cause from transmission HIV AIDS in Papua and Asia because maybe influence decrease religion value. What's your opinion about it? Thank you.
Religion.
Can you repeat?
Sorry, can you repeat? You asked about the effect of religion, I think. Is it correct?
Okay. Like this your presentation about HIV transmission in Papua in Asia, with prevalence is very high cause, multiple sex partner and commercial sex behavior. My opinion, root cause from transmission HIV AIDS in Papua and Asia because maybe influence decrease religion value. Religion value. What's your opinion about it? What's your opinion about it? Thank you.
Okay, thank you.
Okay, we got your question. Next slide is UI Salemba. Please, if you have any question.
Okay, my name is Taufik. The question is, Prof. Pandu, you told us that HIV epidemic in Indonesia and Vietnam is still grow and become more diverse, and HIV prevalence in some country like Thailand and Cambodia, Myanmar is already declined. So the question is, why? What is the factors does the program work? Does our program work, or you think that a lot of systems of our program that should change? Thank you.
Thank you. Now I give the opportunity to UGM, Gajah Mada. You in the first session you don't have any question, but right now if you have any question, please. UGM. Okay. Okay. If there is no other question, there are two questions, and then I'll give Pak Pandu to answer the question.
Okay. The value of the community, yes, will be influenced if the value is influence the behavior. If the value is not influence the behavior, it means the value is not important. Like in most Asia, why the women tend to have few sexual partner? Because their value is different. It means that this kind of behavior is give us a big impact, because if the women got infected, mostly it's come from their sexual partner or their husbands. And if the woman got infected because she doesn't have another partner, it means that HIV stop to them, not continue to another. If the behavior women in Asia or Indonesia have some the same with men, Indonesia will have trouble to prevent the HIV epidemic, because the HIV continue to transmit to their sexual partner. Maybe this is analog with this, some norm behavior or some value. If the influence behavior, yes. And the second is also know about the prevention. How can they prevent themselves to be infected? This is also important. The level of knowledge is also important, especially knowledge about prevention. And the third is maybe Papua is higher because the circumcisions is few or less compared to another area. There's still many possibility that why in Papua is higher prevalence HIV compared to another area in Indonesia.
The other question is about the program that is going well in Thailand.
Okay.
And Taufik asked about your opinion about how the program in Indonesia, is it working well, or what is the problem and how to solve it?
Okay. Thailand, Cambodia, and Myanmar is small country. They have a good system. I mean, there are also many technical assistants that they understand the problems. They have success in the sexual transmissions, like Thailand, success in the sexual transmission in the brothel area, but not yet success in the preventions among drug users. They still failure to prevent HIV transmissions among drug users because different opinions among stakeholders. It means that in some country, if all stakeholders have the same understanding of epidemic and the same good strong program, it means that probability to have success as to stop epidemic is high. And Indonesia is different. Indonesia is very different because the variability of epidemic. It means that local province or local kabupaten should understand their own epidemic and their own program. By looking their own epidemic, they have unique program for their own specific epidemic. Not program in Jakarta duplicate in like in Papua, because the Papua is different with Jakarta. It means that every local epidemic should be understood, because look at the epidemic in another country or in another area is not maybe we can influence, we can learn from their mistake or they can success, but understand the local epidemic is more important, and then based on this knowledge, and then we can have a good program how to overcome this kind of epidemic. This is the key success for epidemic.
Thank you, Pak Pandu. Sorry we missed Universitas Erlangga, so this time I'll give Uner the opportunity to asking the question.
Yeah.
Please, Uner.
Okay, thank you. My name is Rismia. I'm from Magister of Nursing, University of Erlangga. Professor Pandu, in Indonesia we know that a lot of people work in other countries such as TKI or TKW, usually we call it. Is there any relationship between the migration of our workers with the spreading of HIV or AIDS? Because we know that in some cases they turn into multiple sexual partners. If these issues are related to each other, does the government have any programs, any actual programs to solve this problem? Okay, thank you.
Thank you, Pak Pandu. I think the question is clear, please.
Okay. This is true that migrant worker who work and then leave their family or their sexual partner in the country, or migrant worker within the country itself also tend to be high risk, because like Indonesia, the male client, we can say that the male client is men who mobile, but they have money. 3M, mobile men with money. Because if they mobile, leave their sexual partner or their wife, and then stay longer in the one area, but they have money, they can have some, they can buying sex. It means that this is like the migrant worker in the country. But migrant worker who work in the different country is not all high risk behavior. Some of them, yes. Some of them has practiced sexual behavior, I mean the high risk behavior. But maybe some of them also sex worker, we don't know. Because now is sex industry is moved out beyond the country. Like in Jakarta, you can easily get sex worker from China or from different country. Even in Papua, we can get from European or from China sex worker. It means that if migrant worker is sex worker, is maybe high risk. But if migrant worker is work, and but because they stay longer, stay far away from their sexual partner, if they don't know how to prevent themselves, it means that also getting high risk. It means that many of the some like manpower department already instruct to have some training pre-departure for the migrant worker who will work outside of the country. It means that some intervention already there, but maybe insufficient to among them. But the more important is like many women working outside the country, but the husband stay in the country without their wife, also high risk. have some high-risk behavior, like we call it pria yang ditinggal istri, PDI. It means that some of them is get money from received from their wife who work outside, but they don't have wife in here. They tend to be also buying sex. It means that this is difficult situations because the poor or the situation that looking for income for the family sometimes also falling to high-risk behavior because they don't understand the situation. It means that in the future, the epidemic of this kind of behavior should be looked at more deeply to understand. If they have to tend to be high risk, we should have some program that's focused on them. Thank you.
Okay, thank you. We already have the opportunity of all the sides to ask the question. I think our time is end this time. And if you still have any question, you could post in our website. Okay. Yeah. Yeah, and then if you still have any question, you could post the question in the www.cml.ui.ac.id. And also, please don't forget to fill in the online evaluation through the website www.clr.ui.ac.id/GDLC/news. This evaluation is important for us to evaluate how our video conference course